We're very happy to receive this funding, and this funding will go towards research to help us to improve the imaging diagnosis of patients with traumatic brain injury. It's very important to have a way to objectively identify patients who are at risk. Athletes are by definition competitive people. They want to go back and they want to do things again. And we know that if you injure the brain once, that brain needs time to heal. If you repeat the injury, it's worse than the first one, and it tends to accumulate. And you have cases that were widely published and reported of people who became demented at an early age because of repeated injuries and so on and so forth. So, and currently we base our guidelines on neuropsychological tests and clinical examination. There is little imaging, little objective way. There's no objective way of actually saying, okay, you have a problem, your problem is still there, don't go back to play. If we can find that, then we can provide more. I mean, it obviously won't replace the clinical examination, it will not replace the neuropsychological test, but it's another way of confirming that, of showing, okay, this is another piece of evidence that tells me that your brain is now healed and you should be okay to go back and play. And this will also apply to, for example, the military. This will also apply for police or for people who are involved in high-risk activities and can suffer injury. So in terms of how this is going to affect patients we're seeing day to day in Emerge, as a neurosurgeon, we rarely get involved directly at the first care for a patient with concussion. This is a patient who had a mild head injury, who fell playing hockey or who fell playing on the ice or something, and it's fine, and he's talking, he's walking, so there's no reason for the emergency physician who called the neurosurgeon. He orders a CT scan of the head. That CT scan is normal. So this patient is sent back home and often said to go back to work tomorrow or to take a couple of days and then rest. But we also know that a large percentage of these patients, about 15 to 30% of these patients, will have problems. They will have issues with coordination, concentration, with mood, that will make it very difficult for them to go back to work immediately. But currently we can't tell. The next step is to, based on our pilot studies, to develop a more, a bigger group of people, look into a bigger group of people, do more tests, and see how long that lasts and get more information about this, about how this affects the brain, when this happens. Is this like very soon or it just happens later, and how long it lasts. And if it decreases, does also the symptoms decrease? Because if that's the case, then we have for sure something that actually can use to mark that population and say, okay, this is the problem, let's focus on that.